I'm Dr. Bernadette Raja. I'm a local pediatrician. I have a practice here in the Windermere area.
Oh, hold on one second. It just looped. Hold on one second. Okay, we're live now. Hello there.
Hi, how are you?
Hi. Well, I'm just really, really honored to sit down and have a conversation with you, Bernadette. I know that you're very busy right now, and we first met because our children attended the same school together, and I'm grateful for you to take time to sit down and share a conversation with everybody about what you're experiencing, both from the mother and parent role, and obviously also as the physician and pediatrician role. Can you share with everyone, I know about you, but can you share about yourself and
Sure.
what your background is?
Sure. So I'm actually a pediatric intensive care physician as well as a general pediatrician. So I used to work at the hospital in the ICU setting, taking care of the really sickest children. And then in the last few years, I opened up an urgent care, primary care practice in the Windermere area. And I do a little bit of everything from, anything that can be done on the outpatient basis, stuff for like acute emergent ER visits, like sutures, fractures, and then just your regular healthy well care visits and things like that.
You've taken care of our kiddos, and we're grateful for that very much.
Yeah, well, I love seeing everyone in the community. It's nice to see them when they're healthy and well. It's a little different than when I was in the hospital, because most of my kiddos were really sick. So it's kind of nice to be on this end of it.
Yeah. So we obviously know we're navigating coronavirus, and you and I had shared some conversation. Just there's so much we can talk about.
Yeah.
Where are we at right now through the eyes of what you're experiencing? I just feel like the medical community is on the front lines in a way that we just can't even understand. Can you talk us through a little bit about what you're experiencing?
So right now, I think in the medical community, everybody's trying to buy time to just prepare. We may not be locally seeing the surges that they are seeing, like in New York and New Orleans, where you're probably seeing on the news that they're just inundated. But that's kind of predicted to happen in the Florida area and all these kind of hot spots that they've located. We obviously do have positive cases in the area, and it's kind of why the guidelines have come about, where we are recommended to stay at home and keep our families protected and keep our elderly and those of all age groups, the youngest and the olders and those with other illnesses, at home, kind of safe away from everyone. But right now, I don't think that the hospitals or the practices have seen like a super surge of patients just yet. I'm sure it's coming there, but the problem is, as you may have heard, is they're trying to get equipment, and that includes, simple things as masks and gowns, PPE as we call it, and then ventilators and other more complicated things, because the estimation is that some of these patients are going to need those requirements. A ventilator can help sustain someone so that they could just recover from the illness and survive, versus not being able to provide that to them if we don't have it available to us.
In your practice for Advanced Kids Care, which is just north of Windermere in the Orlando area, and as I mentioned, our children have been there. We're grateful for the service you provide. Are you still performing well checks?
Mm-hmm. So
and what does that picture look like?
Yeah. So actually, at this point in time, you would think, we've talked about social distancing, we've talked about trying not to do things that aren't necessary, but we find that it's really important, especially in the medical community, and like I said, the extremes of ages, so that means the little ones as well as the big ones, or the older ones per se, are the ones that are most at risk. So what am I doing here with well care as well? What we're trying to do is, especially the youngest ones who still haven't fully been vaccinated, we need to get everybody in here. We need to get them, talking about nutrition and just prevention. Prevention is always the best, What they are also finding along with this virus is that there's a 40% co-infection rate. What does that mean? That means that children or adults or anybody, they get the coronavirus, but then they're also getting flu, other viruses on top of it. And those could be looked at per se like a comorbidity, in the fact that they would be higher risk for requiring hospitalization, things like that. So how do we help with that? Well, we don't have a vaccine for the COVID, but we do have a vaccine for flu. And so trying to reduce the risks, with other illnesses will really help make sure that, if your child should contract the virus or any family member, that they're a little bit more protected. So the whole process here, our life obviously changed. We are cleaning hourly. We have timers, whether we have patients or not, that are heavily cleaning the place. We've spaced out our appointments so that we are following the less than 10 people in the office, including our staff. We don't have people sitting in our waiting room anymore. We bring them straight back. We don't even have you actually standing at the front desk talking to our staff person, not because we don't want to put anybody at risk, so we bring you back and then we get you checked in, and then we try and get you in and out as soon as we can, but in the safest way possible, but also providing care for your child. And we are also doing sick visits in the afternoon. So what we do is we do all the healthy, well kids in the morning. This place gets deep cleaned every night, obviously. And then by lunchtime or whenever our healthy visits are done, we switch to sick visits so that we can make sure that at the end of the day, the place gets cleaned again and ready for healthy kids the next day. We've also done some other things with allocating certain rooms just to be extra safe for only healthy kids. And so we don't even put sick kids in those rooms. And, we've had to kind of play around with it. So it is a little different from your regular visit when you come in, but it's been well thought through, as much as, we just ask that maybe one parent come, and then we'd have people waiting. If a lot of people showed up for some reason, we'd have them just wait in the car. So not to expose, our staff, because our staff needs to kind of stay here through the long haul, and also we don't want to expose you guys.
And we're so grateful for that.
So.
Just you explaining and walking through the additional protocols that are in place now as a parent eases my anxiety too, because so my family is on this is day 20 of choosing to stay home, and really the only thing that we've done is go out to take walks or bicycle rides and keeping social distancing. So we're on day 20.
And it's hard. I know it's not easy.
It's hard, but really, I mean, I have a relative who's in the medical community as well. And so even in those moments, which we have our breakdowns, which I'd like to talk about that as well, as we have our mental moments where we're frustrated and quite frankly, angry. But hearing you talk about the protocols does reduce some anxiety that I've had as a parent, which is, gosh, okay, so we're safe here at home. Don't get injured. Don't need to go to the doctor. Like, I don't really want to go to the doctor, but hearing you and in our conversation before, it eases anxiety, and hopefully parents will see that you are taking such amazing steps to make sure that when we do, if we need your service, you have the best setup possible.
Yeah, we wanted to make sure that that was the case, because we are healthcare providers, and we know the numbers, we know the data, we know what's going on with this, and we know what's best to also prevent it. And, we can't offer anything less, especially for our children in the community. And I will tell you, keeping kids cooped up at house are not easy, right? Trauma, everything else. You're like, don't jump from there. Where are you gonna? No. I have the same battles at home, but yes. Should that happen, we can put sutures in, or we can provide an x-ray, and everything is cleaned, and we'll make sure that they're taken good care of. And it may be also a better option than maybe inundating the ERs right now that are seeing adults, children, everybody, and being exposed to potentially others that are sick.
It's a good thing to remember. So you mentioned that you have some of the same challenges we do, which is trying to navigate having kids at home. You're a parent as well, and you have two beautiful children. Can we talk about and dive into what I know we're all feeling challenged with is, how do we navigate their mental mindset well-being, as well as just giving them age-appropriate information when even we as adults, I have my moments. I've literally, I had a day not so long ago in the afternoon where I wasn't my finest moment. It did get to me. I was feeling angry, And then I went and I apologized to my husband and both kids. And I said, okay, we got to take a deep breath and we have to just allow each other that if you're angry, say you're angry, because I'm going to have moments where we're good, we're blessed, we're good, but this is frustrating. It
Yeah.
seems not fair. So can we talk a little bit about your advice on how we navigate this as parents?
Sure, definitely. So first, we got to kind of recognize for both adults and children, it's a loss of control. None of us have control over the situation. And so that's really hard for many of us, right?
Yeah.
We can't change it. We can't control it for our children. We can't do it for ourselves. This is what's recommended. You want to follow the best practices to keep everybody safe. So I think the next thing to also remember, our children are very resilient. Like we forget that, and that's why I love taking care of children and working with them, is they're really resilient and they understand a lot more than we give them credit for. And I think really just being very simple, straightforward, explaining to them and being open and honest with them is the best way of handling it. There's no, they're going to turn on the news and hear about death and that's going to be scary, right?
Yeah.
So
Yeah.
you kind of have to confront it head on and not just let them sit and fester over that and just be like, those are kind of predictions. Do you understand what a prediction means? So do you understand that we are working together to try and bring those numbers down? Those haven't happened yet. And so I think it's just kind of walking through and helping them, because sometimes the media likes to dramatize things, right?
Yeah.
And to us, we know we're more experienced and we know to take it with a grain of salt, but children may not be able to get that, right? They said, well,
Right.
Mom, they said, and so you just have to be open, honest, and do that with them. Now, how do you do with everything else from the homeschooling to
Yeah.
keeping them, trapped at home? That's hard. I mean, I find that difficult for ourselves too, but I think structure. Children are great with structure. Obviously, if it's meant to be their spring break, I think you got to give them their spring break, because a lot of people aren't traveling or doing anything, obviously, but they need their time that's got to be off. And I think most of the schools are trying to adhere to that. And I would think that would be important. So next week is my kids' spring break, and I've already promised them, you guys do your schoolwork, do your stuff this week. Next week, we're going to, have some fun stuff. You guys can pick and choose, obviously within the realm of staying at home and doing stuff, but we'll pick out some of those things. And most of the time, children really are actually enjoying this time, because what do children want? Undivided love and attention. They don't say it, they don't come out and express that, but I think in some ways I like to say the silver lining of all of this is we've all kind of, even in our household, yes, my husband is a physician too, and we both go to work, but we're eating a lot more meals together because there's no running to soccer, there's no running to swimming, there's no, and I think we have to take those moments and, there's the hard parts of this, but there's the good parts of it too. And those are memories that you're going to form that, the kids are going to remember when they're older and say, oh yeah, like, it was kind of tough, but it was actually kind of fun. I had Mom and Dad playing games with me. I had, which they probably don't get all the time with our busy lives.
That's so important. We've been talking a lot about that here, just myself and the kids, is yes, there's been a lot of Zoom calls, there's been a lot of remote meetings. We've been working very long hours at home in our business. However, they're right now in the other room, one room away, working on an assignment. And after we're done here, we have the middle of the day where they say, well, let's go for a walk. We can go for a walk. That never would have happened before. And so we are focusing as much as possible on those times. And to your point about the meals too, and I know it's different for the medical community and our first responders, because you all are, God bless you, you're going out to work every single day, but most of us, many of us are in the house nearly 24/7. And so we're eating 3 meals a day with the kids, which is that's
never
that's
happens,
cool.
right?
It never happens. Some days lunch might be very light because Mom and Dad might be in a meeting, which brings me
But
to the
still.
next. Yeah, I was going to say, so how do we manage the parent guilt, right? Like they are needing to be self-sufficient because we do have to work.
Mm-hmm.
So I have guilt over that.
No, you shouldn't have guilt over that. I think that work is also good to teach your kids about, right? I mean, that's a fact of life. Things have kind of put on hold right now, but look, mom and dad's responsibilities extend into the household. Like, yes, we can't go out there. We got to try and protect everyone. But unfortunately, to pay the light bill, we got to keep this going, right?
Right.
And kind of show them that. And I think it's also an excellent time. Many of us, and we never did this before because of our crazy, hectic lives. And trust me, we're all blessed, right? A lot of us have people that are before this coming into the house to clean and do things like that. We've come up with chores like teaching them, this is how we got to wash the dishes, put them away. And it's become a family thing now. And I think
Yeah.
those are kind of the added little bonuses that our kids will get, out of this. I spoke to one of my neighbors yesterday, and his daughter's going to go out to college in the fall. And he's like, yeah, well, I took the opportunity now to show her how to do laundry, right?
Yep.
Because,
That's perfect
many
timing.
people are having their housekeepers and things like that coming in. And just even normally parents are probably trying to do it with working and everything else. But now is the time while they're home, because I know a lot of the classes and stuff, they may get work, but they've got time in there to, do other things. And it's not like they can go hang out with their friends or,
Right.
do those
That's
things.
probably been the toughest thing as a parent, is to see the kids. You mentioned they're very agile and they're resilient. And I do recognize that even in my own kids. I've been shocked at how there's been so many things, they're seamless in their
Yeah.
agility. The tough thing though is they do miss their friends. And while we can compartmentalize and realize, like, you and I might be having this meeting remotely right now, we know we're going to see each other again. Sometimes the younger kids, they look at it and they go, really, again?
Yeah.
When are we going to actually get to go play on the playground with our kids,
Right.
our friends? So
Right.
that gets to be a little challenging.
No, I agree with that. And I've noticed that. I noticed especially like when my son, who's in third grade, like they had their community classroom discussion, and all the kids were like sending messages how they missed each other and stuff. And I get that. And, I felt a little sad for all of them that, that's their work. They go, that's their social network. That's everything for those kids. And we've taken that all away from them. So, normally we don't recommend as pediatricians too much screen time and things like that. But I actually think at this time it's perfectly normal, as long as monitored with parents, for people to do FaceTime, or there are different apps. Like one of my friends sent me House Party, where they've got like games and things like
Oh,
that. And you
okay.
can get 3 or 4 people on there at the same time, so they could have like a play date on virtual. And so my son has been chatting with some of his friends over FaceTime, so it gives them like, oh, okay, I get to see them. And then likewise, his friends who are also bored at home, their parents are like, oh, thank you.
Right.
Gives them like a few minutes to get away and, let them get together. So I think adding those things kind of also adds a bit of normalcy, like, okay. And then just reassurance, always just having that open conversation, like, this too will pass, right? We
Yeah.
just kind of have to go through it. It seems tough right now, but this, we'll get through it. And we just have to, do what's best and what's recommended. And I think our children will be better for it, really. I do think that's how it's going to be.
I would agree with you on that. We need to allow ourselves to have the range of emotions at times, and our children, I think.
Yeah.
And we need to know that there's a lot of good that will come out of this. What can we as a community, whether we're looking at our Orlando community or even globally, what can we be doing? I mean, the updates that came out from the government yesterday were obviously, they were eye-opening. And so again, many of us are on multiple day after day that we've been choosing to stay home. What can we do? Continue to stay home, right?
Yeah, I think that's it. Continue to stay home. And then if you have elderly neighbors, people that just can't, they have some medical conditions or whatever, and you really don't think they should go out. If you're going to your groceries or you're ordering Instacart and they're not the type to know how to do that, that generation isn't the type that would get on an app and have their
Right.
groceries delivered. Just even offering that to them, I think really would help them and save them. Because, even going during that early hours to the grocery store, it's a little nerve wracking for them. especially given that this virus lingers on things, and no matter how, careful and how cleanliness is adhered to, the less exposure that they could have, the better it would be for everyone. And then also the transmission gets kind of nipped in the bud too. So I think those are the best things that you can do as a community, and just supporting each other, having these conversations, talking to your girlfriends. I mean, I think that even for your children to mirror that, like having, parents need that out as well. It's great to be with your children and enjoy that time, but it's also equally well to be on a Friday night as if you were going to go out with your girls, but like, all right, I'm actually going to get on my conversation with my girlfriends,
Yeah.
I think everybody needs that out too, you know.
It's a global connection. There's never been a time, certainly in my life and probably 100 years, that we can all relate literally across the globe to what each and every one of us are going through. Well, I just want to say, Bernadette, thank you so much for sharing some time, sharing some insight to what is going on in the medical community, and so very grateful for everything that you're doing. Can you share one more time where everyone can find you and how they can contact you?
Yep, definitely. So we're Advanced Kids Care. We're at the corner of Old Winter Garden and Good Homes. And we're right off the 408. So if anybody needs us, they're always welcome to just call our office ahead of time. I don't think I mentioned it before, but for the parents that have sick children that they're nervous about even bringing in or anything like that, we are doing phone consultations as well as telemedicine visits too. So we're all trying to do everything, that's going to be the best interest of everybody. And so, feel free to call. Our number here is, we just recently changed it, 407-635-5545. And you can look us up, but we're willing to, see you guys, take care of you guys. We're here. We're going to be open through all of the, restrictions that they have, because obviously it's a necessity for some medical services, but we're going to keep in mind your child's health. Your guys' health is our utmost importance, and our team's health here. So we'll be really adhering to that. You may want to forewarn the kids. They will be seeing people with masks and gloves and things like that, but that's, it may seem scary to them, but it's just to protect everybody, and giving them that heads up, maybe something that makes it easier for them.
That's a really good point I hadn't thought of, especially for the younger kids, I would imagine.
Yeah.
That's a great point.
It's a little different because they're usually used to seeing our faces, and now, for their safety and everyone's safety, we've got masks on. So they may be wondering, what's going on? Who are you? Like,
Right.
And then now I've got my hair up, and we're only wearing scrubs and doing all kinds of things. So it's not the usual friendly person that they're used to seeing for their regular doctor's appointments per se. We're still here under all of it, but
you're still here, and we still hear your voice, which is warm and soothing, right? That's important. Tonality is very important.
Exactly. So, so once they can hear your voice and then they register it, they do much better. But sometimes maybe if they're younger and parents can reassure them, then they feel better.
That's a great point. Thank you again for sharing. I made sure I tagged you and Advanced Kids Care in the post so anyone can reach out. Again, just thank you for your support to the community and to all your staff. You guys are amazing.
No problem. Thank you for doing this. It was nice chatting with you again. Take care.
Stay safe. Take care.
You
Bye-bye.
too. Bye.